Okay, you're welcome to the OET Study Buddy class organized by Synergies National Network. My name is Olayinka Aremu. Good evening, and it's OET Writing for Doctors. So this is our first recorded class, formally for the OET doctors, for our doctors in the healthcare professionals. As you know that the OET examination, which is the occupational English testing, is applicable to doctors, nurses, physiotherapists, radiologists. About 12 healthcare professions are actually eligible to write this exam. And this exam, you can use it to work in other international countries that requires it. Okay, so as an introduction, again, my name is Olayinka Aremu. I'm the OET Study Buddy Coordinator at the Synergy International Nursing Network. You're welcome. So if you're one of our candidates, you're a doctor or a nurse, this is particularly for doctors, even though you can always, do gain one or two things from the discussion. So it's a quick chat, it's a review of the classes. So if you are joining us for the first time, or maybe you are reading this video for the first time and you're interested in the OET, we have already made an OET masterclass recording which you can access on our YouTube page at Synergy International Network on YouTube. You can see the OET masterclass. So this particularly is just to review some key tips for OET writing for doctors. All right, so and just to also emphasize that in the OET exams, we have 4 modules: the writing, speaking, listening, and reading. But of all these 4 modules, 2 modules are particularly kind of different, not the same for all professions, especially the speaking and writing. So reading and listening is general for all professionals, but the speaking and the writing has some differences, okay? Just like I said, some differences which are kind of very peculiar. So today I'm going to be giving some short tips about just the OET writing for doctors. If you're a candidate, one of our Synergy nurses or Synergy doctors now, and you are writing the OET medicine, for doctors, please pay attention to this. And if you must have attended the OET writing class on the learning portal. If you haven't done so, please go and attend. There are 3 classes under this module of OET writing. You have the first one, which is the OET writing tips. You have the OET writing guidelines and the OET assessment details. Okay, so go and make sure that you have attended the 3 classes. The OET learning portal also has the OET resources where you can have access to all the available materials and some other background documents that will be of use to you. Okay, so make avail of those opportunities. If you have any question whatsoever, feel free to chat me up or send an email to our email address. Now, as part of this OET Study Buddy package at the Synergy, you are expected to have completed 12 writing tasks within 1 week. So 12 writing tasks in a week, which will be assessed. Usually we do group writing corrections and individual writing corrections as applicable. So the more you write, the better. That's my admonition always. The more you write, the better for you. So you can write more than that within a week, but you are required to write 12 writing tasks within a week for you to complete this module. All right, I'm going to start quickly just as an overview of the module, the OET writing for doctors. So like every other module and every other professions, like the OET writing requires 45 minutes and 1 task specific to each profession, okay? And you write a letter in a clear and accurate way, which is relevant to the reader. All right, so This time around, you as a doctor will be writing a letter to another professional. All right, so I know if you have been practicing medicine, or you must have been doing this one way or the other. So this should just be a walkthrough. All right, so all subtests are assessed at the OET Center by trained expert assessors. So you should take note of this. So that's why you have to be very strategic and specific about your writing. So I go straight now to the OET writing. So the writing subset, like I said, consists of a scenario presented to the candidate, which requires the production of a letter of referral to another professional. So you're writing a letter of referral most of the time for the doctors. The letter must record treatments offered to date and the issues to be addressed by the other professional. So either you are referring to an ophthalmologist, you are referring to another consultant, you are referring to another unit, maybe a general practitioner in another hospital. So you need to include the record of the treatment that you have offered to date, background issues of the background medical history of the patient, and the issues to be addressed by the other professional. All right, so the letter must take account of the stimuli material presented. So the stimuli that we're talking about here is a case note. You'll have a case note that will be presented to you, which contains all the, details of the patient or of what the situation, clinical situation is. So you must be able to present these stimuli properly and in the letter. So as every letter, you have the body of the letter that must contain approximately 180 to 200 words and be set out in an appropriate format. So for certain professions, other professional writing tasks of equivalent difficulty may also be set. So responding in writing to a complaint, for instance, or providing written information to a specified audience in the form of letter. So, but we're talking about that of the doctor. So let's do some quick guide to the writing subsets. What are the do's? I have some do's and maybe some don'ts. So do's, number one, take time to understand the task requirement. So look at the writing task. So in your case notes, you have the case notes and then you have the writing task. So read through in between the lines to understand the task that is required of you. Now use your own words to paraphrase or summarize longer pieces of information from the case notes. So you're not to write exactly as it is on the case notes. So use your own words to paraphrase or to summarize. If there's some certain cases where you have to write it the way as it is, especially for some key medical terms, that cannot be simplified or so. And remember, you're writing, depending on who you're writing with, that will determine how simplified that you put your words. So again, understand the task requirement. Now, make sure you understand the situation described in the case notes. This is where most candidates miss it and they don't fulfill the overall task. All right. So make sure you understand the situation described in the case note. Think about how best to organize your letter before you start writing. So you always have like 5 minutes before, 2 to 5 minutes or so to read through. So using this time to organize your letter, what will be in my first paragraph, what will be in my second paragraph, to organize yourself. Use the space provided. There's a space provided to plan your letter. You can use that as to draft something quickly or just to pen down something, though it's not compulsory. Now, use the 5 minutes reading time effectively to understand the task set. So what you need to understand is, number one, what is your role? So for instance, are you a senior reg? Are you an intern? Are you a SHO, house officer, medical house officer? Are you a senior house officer? Are you a consultant? So you need to you need to be able to understand, what is my role in this situation? Are you a referring doctor or a receiving doctor in whatever situation? So you know your role. Okay, so it's also very important that you know who your audience is. That is the intended reader, and this is applicable to all professionals. So even if you're a nurse, you're a physiotherapist, you're a pharmacist, and you're writing OET, your OET writing, you need to, these are just the same things that you need to know. Okay, so So I've said it there, know your role, know your audience. All right. So the next thing you need to also take note of, what is the current situation? This patient has come to you for, for a few days and you'll be managed for this, but what is the current situation? How urgent is the current situation? What is the main point you must communicate to the reader? So this needs to be put into cognizance. All right. What supporting information is necessary to give to the reader? For instance, do you want to say a little bit about the medical background of the patient, social background of the patient? What have you done? What has been your treatment record for this patient? You also need to pull that. And these things will be in the case notes. So do not write outside the case notes, okay? We're talking about the do's. Now, what background information is useful to the reader? What information is unnecessary for the reader? So it's very important that you be able to filter out, like, this information is not necessary. Why is it unnecessary? So that is very important. Okay, so again, if you're just watching this is online car. Please make sure that you are following through, and feel free to ask any question that you may want to ask. Now, explain this current situation at the start of the letter. It's always good that your first paragraph will contain what is the current situation of this patient, and perhaps an emergency situation. Is it an emergency situation? Make sure you emphasize that. Use the names and addresses given. Now, this is not, sometimes you are given a name in the case note. They will say you are Dr. Smith. Even though your name is not Dr. Smith, make sure you stick to that name, or the name of the patient. So use the name, addresses as well. Make sure you use the addresses in your letter. Set out the names, addresses, dates, and other information to start the letter clearly. As you write, indicates each new paragraph clearly, perhaps by leaving a blank line. So I've always advised that to leave a blank line in between each paragraph. Now, what are the don'ts? Don't include everything from the case notes. Remember, you have a word count of between 180 to 200 to write. So don't include everything in the case notes. Select information that are relevant to the task. Okay. Now, don't simply copy chunks of text from the case note. Don't just write it the way it is in the case note. You need to paraphrase and summarize in your own words as necessary. Okay. Now, write notes. Don't write notes or number points. That's another thing you need to pay attention to. Don't write notes and number points. Now, generally, let's talk about, make sure you have a spare pen or pencil ready just in case, and fill in the cover pages for the task booklet. At the end of your writing, make sure your letter communicates what you intend. So we'll talk about the assessment, and you must have listened, watch this in the previous classes. So make sure you meet the basic task requirement, the length of the body, that's the word count, write in full sentences, not note form, and appropriate letter formats. You have the address, the title, the salutation, the body of the letter, which usually you have paragraphs, put in paragraphs, and the conclusion, and then of course the salutation at the end as well. So check for any simple grammar and spelling errors that you may have made. If a page is messy, please use clear marks like an arrow, to just cross to show that this is wrong, rather than painting. Cross out clearly anything that you do not want the assessor to read. All right, now talking about overall task fulfillment, like I said, your letter will be assessed against 5 criteria. Overall task fulfillment: did you include all the overall impression, all the relevant information, or whether the response you provide is the required length? All right, now the second criteria is appropriateness of language. This includes the use of appropriate register and tone in the response. Are you using the appropriate tone? Are you using the appropriate language in the letter? Remember, this is a medical letter. You are a professional, and depending on who you're writing to will determine the tone of your letter. Okay, the comprehension of stimuli. Do you really understand the situation? Do you really understand the case notes? And your understanding of the case notes will help you, to be able to communicate appropriately to your reader. Now, control of linguistic features is another criteria. That's the fourth one, which has to do with the grammar and cohesion. You need to pay attention to this because if there are any grammatical structure or cohesive devices of English that you miss out, this could score you less. Now, control of presentation features like spellings, punctuations, the layout. If you are using a block paragraphing, stick to it. If you are using an indent paragraphing, stick to it. Usually, I'd advise that you just use a block paragraphing. All right, so that's about that. Now, talking about overall tax fulfillment, avoid using informal languages like slangs, spoken idioms, unless you are sure this is appropriate. Like say thank you, use thank you rather than thanks a lot. Okay, so avoid SMS text. Don't use abbreviations that are not, recognized or accepted. So again, like I said, please go through the previous classes or about writing. Now, I want to say this is specifically for the OET Writing for Doctors. You example of a referral letter. I'm going to show you at the end of this class, but just before then, there's something else I wanted to show you. I want to talk about. So this is basically about some things you need to take note of for your OET writing for doctors. So just 1 minute. And before the end of this class as well, I'm going to do a quick correction to one of the letters that has been written by one of the doctors. One second there. This is just taking some time to load. Okay, so here now talking about OET Writing for Doctors. Now, these are some useful cohesive devices that can help you present your ideas clearly and logically. And I want to shift. I know you might know this, but just to revise. For instance, talking about time reference. If you are referring to time, what are the cohesive devices you can use? Sometimes maybe you want to say, at that time. That is one cohesive device you can use. At that time, in the time that maybe you're referring to something that has happened before. So in your letter, time reference is always important. Rather than, you have dates, you can use time reference. You can say 2 weeks later, 3 months ago, or you can say 2 days ago, on our next visit. Since that time, on initial examination, on consultation today, on review today, recently, over the past 3 weeks. So those are like, time reference that you can use on cohesive devices you can use for time references. And if you want to write a particular date, you say on 19/08/2018. Okay. Or you can say on the 19th of August 2020. Okay, so it should be a 19/08/2022, not dots. Okay, not 19 dots. So use a slash. Now let's talk about location. You're trying to reference a location where the patient is. You can use word like during hospitalization, initial examination at my clinic revealed, or you say on examination. So that's a cohesive device for location. Some other thing maybe you want to emphasize something or to continue a particular discussion, you can say more information. For more info, for more information, in addition, moreover, also, apart from this, you are trying to reference more information. So you want to say more things about the particular case. You can say, in addition, moreover, however, apart from this. I've seen some scholars, some schools, what do I call it now, of thought that says that I've advised against the use of moreover. What other word can you use in place of moreover? You can say however, nevertheless, therefore. So like advice, how do you reference advice? What coercive device can you use to emphasize, like to really say, pinpoint that you want to give an advice? You can say it is important to, you can say, please ensure that, or I recommend that you do, that take your medications as prescribed. Contrasts. If you want to establish like a contrast, maybe trying to compare and contrast something, you can say despite, in spite of, or though, or however. So those are the coercive devices you can use to establish contrasts. Now, to explain a result or to state a result, what coercive devices can you use? You can use something like therefore, consequently, hence, as a result, for this reason. Okay, now let's talk about emphasis. You're trying to place emphasis on something, you want your patient or that person to really know that this is really important. You can say, please note that, say what you want to say. May I remind you that, or you can say, my main concern is, what concerns me is, that those are the ways, or what concerns me most is. So that's some coercive device you can use, to repeat emphasis. Now, about sympathy or empathy, because some of the times you come across this situation like that you have to show some empathy. So you can say, unfortunately, regrettably, fortunately, that's how to represent that. Now, subjects, for instance, you want to talk about medical history, or you have a key subject you want to emphasize. You can say, in terms of our social history, with regard to our medication, based on the blood test results regarding our medical history. I usually, for me, don't like starting a sentence with regarding a medical history. Okay, so I rather say I rather you say with regard to our medical history rather than regarding our medical history. You can say our dental history shows that. You can say our medical history includes, so the risk factors include, treatment to date include. So those are like, you have some specific subject that you want to emphasize. So that's just a quick one about some tips you can use as doctors when you're writing the OET writing test. Now, I have what I call it now, something to show you, like an example of a letter for doctors, just for you to, I'm just going to show you like a sample of the letter that was written, and just to read through, and you can get few things from that. All right, so and then I will mark the question there. Okay, just 1 minute. Okay. So I'm gonna have to share my screen there with you. Okay, so this is, I'm going to bring this to the screen there. So we can, let me try it, I can zoom out. So there's an example of a letter here. Show you that, as you can see there, you see the date, January 2014. Admitting officer. I think I can go off for now so you can see it as well. Yeah. Okay, so as you can see there, you have January 2014, that's the admitting officer, that's the address of the recipient. So you see, leave a gap in between, leave a blank space, write the date, leave a blank space, write the, dear sir, that's the salutation. Now, the name of the patient, date of birth, just as it is. I'm writing this letter to urgently refer Joshua Vance, it's a comma, a 2-month-old full-term absolute breastfed infant. Now, note that 2-month-old, there is a dash between the months and the old. Full-term, a dash between the full and the term. Absolute breastfed infant, comma, as his mother has reported that he had not passed any stools for 5 days and he had poor feeding pattern. Your immediate assessment and further management will be highly appreciated. So I want you to study this and look through. If you see that first paragraph, remember I said the first paragraph must have 3 things key. Talk about your patient, the presenting situation, and then the purpose. So 3 P's for your first paragraph: the patient, the presenting situation, and the purpose of the letter. Like, that means what do you require the recipient to do for you. Now, from this letter, you can see that I'm writing this letter to urgently refer. So this actually even talk about the situation, the urgency of the situation. So urgently refer, that's the name of the patient. Who is this patient? Is a 2-month full-term absolute breastfed infant. And some presenting situation there says that the mother has reported that he has not passed any stool for 5 days and he has poor feeding pattern. That's the presenting situation. Now, the purpose of the letter is you are asking for immediate assessment and further management from your recipient. So that's how to state it. And the other way you can write it, as you see there, is you can say, thank you for seeing Joshua. This is for doctors, okay? A 2-month-old John, full-time absolute breastfed infant who has features suggestive of constipation. Your further assessment will be highly acknowledged. That's the first paragraph, nothing more, nothing less. Now, your second paragraph, you can now start with, what the patient came in with from us, on admission. Joshua, who was born vaginally without, that's just some background information. Then you can add up with medical history as well. Like I said, make sure you are using the right grammatical structures and tenses. If you need to revise this, you might have to revise that as well. Now go to your second paragraph and talk about your treatment, plan, or what you have done for this patient. What's the treatment record, male medication, antibiotics, all the tests that has been done. Talk about that all usually in the third paragraph. Then the fourth paragraph will re-emphasize the present situation and what you want, what you are really looking out for. Are there any advice, any recommendation, any particular help or assistance you are seeking that you need to emphasize in the fourth paragraph? And of course, you have the concluding paragraph as well, and your salutation. So remember, yours sincerely is used. Doctor, put the name, either your name. If you are given a name in the case notes, then you use the name in the case notes. So other examples like that, you can take your time to go through it. I'm sure you have this document if you are enrolled. All right, so thank you again for joining in. It's been the Oet Writing for Doctors with Nurse Coach Ola at the Synergy International Nursing Network. Now, I have a case note here that I just want to go through, and perhaps, Mark, to be honest, I will not be doing a lot of corrections with this. So, because there have been some, it's not appropriate, so to say, the letters. So, let me show you one of these letters now. Try to bring it. Okay, I was told I can only share it as a PDF, so I'll try to see if I can convert it to a PDF rather than an image. So if you have any question, please ask, drop it in the comment section. I will go through it. Okay, it's showing here as image. So what I can do is to share it on my Google Drive, and then I can open through the Google Drive. Just a bit of some technical stuff here. Give me a few minutes to sort this out. Thank you very much. Oet Writing for Doctors. Letters. Okay. All right, so yes, I'm still here. Oh yeah, I think I finally got what I was looking for. Thank you for your patience. Okay, I think what I can do is to share my screen. This is proving a little bit difficult. Okay, so the first case notes that I have here for this letter that was submitted is this. So assume that today's date is 15, 2021. You have been Miss Bennett's GP for 2 years, and I've been treating her recently following our hospitalization for cardiac problems. Okay, that's the patient details there. So the patient's name, date of birth, address, social background, family history, medical history. Okay, you can see the time reference there as it flows. Then treatment, medications treatment on discharge, presenting complaints, writing tax now says using the information given in the case notes, write a letter of referral to Dr. Banerjee, consultant cardiologist in your letter. Briefly outline Ms. Bennett's history and treatment so far, requesting advice and a review of her medication. You are writing to request advice and a review of our medication. So address your letter, that's today. So in your answer, expand the relevant notes with complete sentences. So I'm going to show you now what this candidate has written. Let's see. So let me try to zoom out there. I hope you can see my screen. Okay. So first of all, at the side of this letter, it's really hard to read, very clumsy, not spacious, and you have to maintain the margins of every sheet that you have. Okay, so we have a sample of the OET writing sample for writing. So you might need to download that and use that for practice. Alternatively, I encourage you to use an 80 leaves and please maintain the margin. So this is a total no, not acceptable for you to be writing at the margin and up to here. So it's not acceptable. If you're practicing with a sheet like this, you can be intentional to draw out your margin yourself just to make your writing very much more presentable and so that's the first. And again, I've said it's leave a blank space between each paragraph. All right, that's very important. Leave a blank space between the age of the patient, the name of the patient, the address, thereabouts. Very important. So to be honest, it's so clumsy and so tiny. I'm finding it hard to read, but I will just try to see if I can scan through. So now you're writing Dr. Jean Dwyer up here. So I'll say you bring it down. Don't write anything at this upper part. Consultant. First of all, you need to write, that's fine. Dr. Dwyer, this is the address. Then leave a space and write the dates, leave another space, and then dear sir, madam comes before we. Okay, so this dear Dr. John will come before we, Mr. John. All right, so leave a space between the salutation as well and the reference, so leave a space before you start writing. I'm writing to refer Mr. Tony, a 41-year-old patient who is recently assessed for Ulnar syndrome in the clinic. I'm currently working in the clinic. I am currently working. So I think this is in the clinic I am currently working in, or just say in our clinic. His condition is getting worse and therefore requires specialist management. I will be glad if you will manage his condition as you find, I don't know, I'm not sure what this is appropriately. So if we look at this, we have the patient, with patient details, the presenting situation, and the purpose. So I say you be brief as much as possible so to avoid too much repetition and waste of word count. Your word count is very precious. So Mr. Che is married on a daughter. So again, following the first paragraph, which is the introduction, I would say you go straight to the basic thing about this patient medically before you come to social. So they bring the medical details first before the social. Again, honestly, I won't be able to read all through this because it's so tiny and I don't I have my glasses here. So I think if you space it out a little bit and write more legibly, that would be good. Your writing is fine, it's superb. It's just that it's too tiny, sort of, for me. So now let's look at the time reference. I think I've mentioned about this, so you can make some corrections about time reference. So there's no point you repeating, the dates like this on 10:01. So if you have written on the 10th, of January 2017, which is better, or if you're writing on 10:01 2017, comma, you need to have a comma there. Mr. Tay presented. Now this is your Mr. Tay presented with right-sided headache. So. By the time you are going to the next time reference, this is 24:01 2017. So that's 2 weeks apart. So you can say 2 weeks after that, 2 weeks later, that's a time reference rather than repeating the date. Now, again, you're coming subsequently on 29:01, which is like 5 days. So you can say 5 days after this time, 5 days after, or after the next, in the next 5 days, depending on how you want to put it there as appropriate. So that is about that, and I'm trying to get this back. So please make corrections to the time reference, very important. Now I'll go to the concluding part. However, based on, okay, so I don't get this. Based on, this is not clear. Per clinical situation, Mr. Tay was assessed as a case of Hunt syndrome, and therefore we require further management, hence this referral. So just say this referral rather than this referral letter. Should, in case of need, if need, should the case if need, or what's that? I say just say, should you need more information, or should you require further information, please do not hesitate to contact me. I rather say, don't say do not rather than don't. Okay, do not rather than don't, please. And remember, this is comma, so this please should not be starting with a capital letter here. Don't hesitate to contact me. So few of those things, your tenses, very important. Use of capital, small letters, use of punctuations, very important for you to revise that. All right, so I think that's just where I'll draw the line here today for that. Okay, so are you able to listen through? Thank you for joining in, even though we are concluding. Can you hear me, Prince? Can you hear me? Okay, so I can't hear you, but that's fine. We're rounding up now if you can hear me. So recorded this class so we don't waste the time that has been allocated. Hopefully you'll be able to go through, and maybe just before when you join they done a bit of some correction on the last writing that you submitted. It's I personally say it's a good write-up, just the technical aspects that need to be attended to, like I've mentioned, the paragraphing, the tenses, the punctuations, the use of the grammatical structures. You just need to, we know this, like we are not part, everyone speak English, but they are very particular about these minute things, where like using small letter instead of capital letter in between a sentence, you need to pay attention to that. So I say, hopefully, I'll also shared, I think I shared that with you. And for anyone attending this class, you will be seeing some writing samples, or for doctors, that you just need to, it's not for you to cram, it's just for you to get familiar with how, how to write in specific situations, because the reason why you're writing may differ. Sometimes you're writing for referral, sometimes, most of the time, is referral letter. So, but for instance, if you're writing to a junior doctor, or you're writing to another facility, a patient is leaving your facility to another facility. So are you writing to a consultant? Are you writing to somebody that is at your level as well? So this will determine the tone of the letter. And I've always said this, that if you're writing to somebody that doesn't know this patient, so what it says, is there a known relationship between the patient and the receiver? So if there is a known relationship, maybe for instance, your case note says that you are working in an emergency department. You are a reg, maybe a medical reg, or a senior reg in a medical in an emergency department, and a patient coming from a nursing home or was referred to the hospital by a GP, a general practitioner, and now this patient is being discharged or is going back to the GP. So you will know that the GP knows the patient. So there are a lot of information that the GP already knows. So even though you might want to still write a bit of the medical background of this patient, but you will not be too much it's not going to be in as much details as it would be for somebody that doesn't know the patient. So that's why it is important that you read the case notes and the writing task. So the writing task there will tell you, who are you writing to? And that will determine, you'll be able to kind of does this person know this patient before or not? Because like I always say, that every word counts. You are expected to write within 180 to 200 words, which is what you need to pay attention to. Again, you need to be able to determine what is my average word count per line. How do you determine that? So if your normal writing, just look at it. How many words do I write per line? Maybe your average word count is 8 per line. I see you have a very smooth and tiny writing. So probably you're writing your average word count in one line. When I say one line horizontally, when you're writing in a sheet, maybe it's 9. So even while writing, you can estimate that I've written 10 lines. That means I've written 90 words. I have 90 words. So you pay attention to that when you're writing, because you don't want to waste any word. You understand? So that means you have to pay attention to the most relevant information from your case notes that you need to write. So I say this, that when you have your case notes, divide the information in the case notes, mentally, and as well you can make some points, make some notes. Divide it into 3: most relevant, relevant, and not relevant. Now, your task. You have these case notes. They have asked you to write a letter, so. Now, based on this, all of the information that has been provided in the case notes, which one are most important? Now, following that, important, or let me say relevant, and then the last one is not relevant. So you see those ones that are not relevant, they should not come into your letter. Now, the ones that are most relevant are the ones you will start with. For instance, like one of the letters you wrote, the social history might not be most relevant. So you will not start writing about the social history. So what you need to start writing is the medical history that's applicable to the situation. You can now buttress it later on, maybe in the last paragraph or a second to the last paragraph, and talk briefly about the social background. But if you had wasted a whole paragraph on social background, and you still have more, the most relevant things that you're supposed to write, and you don't complete that will affect your overall task fulfillment. Because one of the criteria that they're looking out for is that you are able to complete the task. And what will make you complete the task is if you fulfill, the more if you write, the more the relevant information. So don't waste your word count as much as possible, and try to estimate your word count even as you write. And how to do this is to have a background, a foreknowledge of how many words do I write averagely in 10 lines. If I write 10 lines, how many words will that give me? So how you can know that is in your normal writing, find what is the average. The first 3 lines, add it together and divide by 3. So you will know your average word count, per line. And that will determine if you write 20 lines, my average word count per line is 7. So I know that if I've written it's easy for you to just count the lines. I've written 20 lines. In 20 lines, that gives me 20 times 7, that's 140 words. So this will guide me in my writing. So I won't just be writing irrelevant things. So once you know that you're running out of word counts, know that you have to focus on the most relevant, because the more relevant things you write, the more mark you get. I hope you understand what I'm trying to say. So that's just the conclusion of that. So we're rounding up. So thank you for joining in. Again, my name is Olayinka Aremu. I'm the OET Study Buddy Coordinator at Synergy International Network. And today we have just given a quick recap of OET Writing for Doctors. Yes, like I said, the OET writing and the OET speaking is specific to professions. So we have done the OET writing, and the next one we'll be having will be the OET speaking. So if you are a registered candidate, I will advise that recommend, as usual, that you attend all the classes, from the learning portal, and write as much. You are required to write minimum of 12 letters per week. Minimum for assessment, minimum of 12 reading. You can do more than that. You can, like we have loads of resources and case note for you to use. So, but the minimum required for this module is 12. So keep submitting that, and we will continue to assess. Thank you very much. If you have any question whatsoever, remember that our chatting line on the WhatsApp group is between 9 a.m. and 9 p.m. We try as much as possible to respond within this time. Otherwise, we respond as soon as we can. Thank you very much. Have a lovely evening. Bye-bye.